So this video is for patients with varicocele, because there is always one question in the minds of varicocele patients. If varicocele is treated, will it relapse or not? The first question is whether after undergoing surgery it will relapse or not. Let's see. Simply put, the control over relapse is neither with any doctor nor with any source that you can consult. The control is solely and exclusively in your hands. This means that the remote for managing varicocele is always in your hands. If you want, you can have relapses done tomorrow, or you can choose not to. The control is in your hands. So today I will talk to you about the chances of relapse in varicocele, why it happens, and how you can prevent it. The last part is important. You should definitely listen to it after you have undergone varicocele surgery and recovered. How to control it is crucial because no one guides you on what to do next. The surgeons just perform the surgery and then say it might happen, but you need to be careful to avoid relapse. No one will tell you how to prevent relapse, so today I will also share methods to ensure that it never happens. And if your relapse or varicocele is still persisting, how can we address it? Today, let's understand a simple thing. There are chances of relapse in varicocele. No matter where you go, whether you go for surgery, Ayurveda, or homeopathy, the reasons behind it are your own habits. Let's talk about those habits first. Varicocele is not something that someone is giving you as a disease or something different you are experiencing. It is basically a lifestyle disorder. Consider that there are certain daily activities that are putting pressure on it, and that pressure is what is giving you varicocele. Now let's say I go to the gym every day. I know I have varicocele, but I still go to the gym wearing a supporter and some shape of underwear. I go there and comfortably exercise. I do running, cardio, and weightlifting. After that, I wonder what will happen to my varicocele. Even if my varicocele has been fixed by surgery, I still go. Then, if my varicocele relapses, what does it matter? If the gym exercises are causing my varicocele, it means that the gym is a cause for me. It is a reason that has contributed to my varicocele. Now consider the second example. If I suffer from constipation every day and I have to strain, when I go to the bathroom, I am constantly straining to pass stool. If I am not addressing the issue in any way, what will happen? The repeated pressure from constipation on my abdominal pressure or in the lower pelvic area will affect me. It will impact my lower scrotum area where the testicles are, generating pressure in the scrotum repeatedly. This pressure can lead to pain in the veins due to the repeated strain, and as a result the veins may slow down, which will eventually give you some relief. The second example is that if you reduce constipation, you might not experience relaxation, and if you have varicocele, working with the right patient can provide relief. Now take the third example, which is mostly found in varicocele. Suppose we are patients with varicocele. We need something for traveling. So what do we do for traveling? We often use scooters and bikes very vigorously, even for a short distance. What happened to the bike? The seat of the bike is getting hot and the rider is facing a lot of trouble. The heat is so intense and the scooter's seat is getting so warm, yet we will still sit on it and go for a ride no matter what. Now, these little things that happen can give us even more issues. In heat, what will happen is that our testicles will try to hang more, and even if you have recovered from surgery, there are still chances of increased hanging due to more load on the veins. When there is more load on the veins, it can increase your chances of relapse. Similarly, if you are a patient with varicocele and frequently use a scooter or bike, the hot seat can also trouble you, increasing hanging, which will lead to more pain and inflammation. Additionally, there is another reason related to using a scooter or bike. When we sit cross-legged, the area that makes the most contact with the seat is our scrotal area. And when there is a bump, it's not like the scooter has such great shock absorbers, or the bike has such excellent shock absorbers that they can absorb everything. When we ride, what happens is that the impact of the bumps is reduced, but when the bike or scooter hits a bump, the impact directly affects our testicles and our seat. Now, there can be a difference between hitting one bump and getting slapped once. It means you are either attacking in small portions, repeatedly, or attacking all at once. In that case, it will be less. Such attacks happen frequently, and if such attacks continue, they will cause you trouble, so this can have an impact. So, I am giving you some examples. If you have understood the cause of your varicocele, you will be able to prevent your varicocele from relapsing and also stop the grading of side effects from increasing. By following simple methods, you will feel better, and the grading of your varicocele will also improve, helping you avoid side effects. If you like this video, please like, share, and hit the bell icon. With that, we will meet in the next video. Until then, goodbye. If you have any questions or do not understand something, feel free to WhatsApp the number given below to report and consult with my team, which is also free.